Okay, friends, let us talk about new 5 marker question, which is frequently asked question, that is oxytocin. Oxytocin is basically a uterine stimulant, one of the type of uterine stimulant. Uh, Let us see how it is produced and how it works, what is its mechanism of action, and what are its side effects and what are its uses. We will see this one by one. Okay, first of all, oxytocin. Oxytocin, it is a hormone synthesized in the hypothalamus along with the antidiuretic hormone. But this oxytocin, even though it is synthesized in the hypothalamus, it is stored in the neurohypophysis. Neurohypophysis is a part of the pituitary gland. There are two parts: adenohypophysis, neurohypophysis. Adenohypophysis is anterior pituitary, neurohypophysis is posterior pituitary. So, oxytocin hormone, it is produced in hypothalamus, but it is stored in the neurohypophysis or posterior pituitary. The storage and release and action of oxytocin are सबसे पहले सिंथेसिस कहाँ होते हैं हम देख लेते हैं. The synthesis occurs in the supraoptic and paraventricular nuclei of the hypothalamus. Hypothalamus has different types of nucleus. Among them, this supraoptic and paraventricular nuclei produces the hypothalamus along with ADH, antidiuretic hormone. And then through the neural path or neurohypophysis, it is stored in the posterior pituitary. Oxytocin is released due to parturition or suckling effect. Suckling effect, hope you know that when a baby sucks the nipple, it is called suckling effect, or during coitus. All these things causes the release of oxytocin. This oxytocin basically has certain actions on the uterus as well as on the breast. In the uterus, it causes vigorous contraction, especially during the parturition. And in the breast, basically it causes the contraction of myoepithelial cells during the milk ejection. When the baby sucks the nipple, this causes the release of oxytocin, which further helps in the releasing of the milk. Let us see the pharmacological actions of this oxytocin. Chalo, on the uterus, oxytocin stimulates contraction of the pregnant uterus. Uterine is highly sensitive to oxytocin. Oxytocin basically increased by the estrogens. When the level of the estrogen increased, obviously the level of the oxytocin increases. That is, O is directly proportional to O. Means whenever the estrogen is increased, oxytocin also increase. But the level of oxytocin is decreased in the progestins. So non-pregnant uterus is relatively insensitive to oxytocin. In early pregnancy, uterus is fairly resistant to oxytocin because if there is a contraction of the uterus, there might be chances of this abortion. So early pregnancy, uterus is fairly resistant to oxytocin. High dose of oxytocin is required to stimulate the uterus. As there is stimulation of the uterus, obviously there will be a parturition. So this level of oxytocin should be reduced during the early pregnancy, but this oxytocin is essential for the parturition. So oxytocin increases both force and frequency of the uterine and contraction. Then what they say is, with intravenous infusion of low dose of oxytocin, there is a period of complete relaxation between uterine contraction. This helps to maintain the blood flow to the placenta and fetus. But only a little dose of oxytocin helps the maintenance of blood flow between the placenta and the fetus. See, there is a placenta, there is a fetus, this blood flow need to be maintained properly. So IV infusion of this oxytocin might help in the maintenance of blood flow. Therefore, this prevents the fetal asphyxia. Large doses of oxytocin further increase the force, which may lead to fetal asphyxia. Okay, let's see the mechanism of action, how it works. See, this is the uterus. Oxytocin binds to the specific G protein coupled receptors on myometrium. This uterine has three layers, basically endometrium, myometrium. There are different layers of uterus: endometrium, myometrium. This myometrium is the muscular layer. This muscular layer has the specific G protein coupled receptors. What we have? G protein coupled receptors. This oxytocin goes and binds with the G protein coupled receptors present on the myometrium. This leads to the generation of IP3. When this IP3 releases, there will be a release of calcium into the intracellular stores. Basically, the function of calcium into the muscle causes contraction. So, this calcium which went to the intercellular stores increases the production of prostaglandins. So, this prostaglandins helps in the contraction. This is how the oxytocin helps in the contraction in pregnant women. Then let us see how does it works in the breast. In the breast, oxytocin contracts the myoepithelial cells and causes milk okay. There are myoepithelial cells in the breast. This oxytocin go and acts on it, which causes the milk ejection. In the kidney, if the oxytocin is at high level, it gives ADH like action. That means decreased urine output. Then water intoxication may occur if large amount of fluid is administered along with oxytocin. If large number of fluid है ना, अगर मान लो ऑक्सीटोसिन के साथ हम लार्ज नंबर ऑफ फ्लूइड को एडमिनिस्टर किया या ज़्यादा पानी बॉडी में एंटर हुआ तो वाटर इंटॉक्सिकेशन में अगर ये ऑक्सीटोसिन इफ यू टेक ऑक्सीटोसिन इन हाई डोजेस देयर मे बी वैसोडाइलेशन and transient hypotension, which might cause reflex tachycardia and flushing. Hypotension might be caused due to vasodilation. Okay, let us see how this oxytocin is prepared. This oxytocin is not effective orally because it is a peptide hormone. Peptide hormone means protein. We know that when the protein enters stomach, due to acidic pH, denaturation of protein occurs. So, synthetic oxytocin is commonly used IV, intravenous fusion or intramuscular. Symptometrin, 1 ml of 5 international unit oxytocin and agrometrin, 500 microgram is given. Symptometrin is the combination of 1 ml oxytocin with 500 microgram of agrometrin. It is given intramuscularly. Okay, now let us see what are the uses of pharmaceutical uses or therapeutic uses of this oxytocin. Oxytocin, it is the drug of choice for induction of labor. Labor means contraction of the endometrium or endometrial contraction. Okay, we know that it cannot be given orally, so it is administered by IV infusion. The starting dose should be low and the rate of infusion monitored and adjusted according to response. We cannot give the oxytocin directly in large quantity because it might cause hypotension, reflex tachycardia and flushing, and also it may cause hypotension due to vasodilation. So initially we need to give a little dose of oxytocin. According to the requirement of the patient, we need to increase the dose of oxytocin. During oxytocin infusion, uterine contractions, maternal blood pressure, and fetal and maternal heart rate should be monitored because it might cause fetal asphyxia. High dose of oxytocin might cause fetal asphyxia, as we read above. Then oxytocin is preferred for the induction of labor because dose can be adjusted according to the response, and also it has short pharma half-life. Since it has the short pharma half-life, the effect can be terminated immediately. If it has long effect, we don't know when to stop and when to start, but it has short immediate action. So when we stop it, its action will also stop. That's why it is the preferred drug of choice during the induction of labor. And also it is said that at low doses there is a period of complete relaxation between the uterine contraction, thereby preventing fetal asphyxia. It prevents fetal asphyxia, low dose, but high dose induces fetal asphyxia. It does not interfere with the fetal descent as it does not contract the lower segment of cephalopelvic disproportion, placenta previa, previous classical, cesarean section, transferred fetal life, fetal distress should be excluded prior to administration of oxytocin. So one more thing, it do not interfere with the fetal descent because it does not contract the lower segment. Now even the oxytocin is used to prevent the postpartum hemorrhage. This postpartum hemorrhage is nothing but the bleeding after the delivery. So oxytocin here, same thing, intramuscular or intravenous infusion should be given. It contracts the smooth muscle resulting in the compression of the blood vessels. As they pass to the myometrium, bleeding is arrested. When the smooth muscles is contracted, the blood vessels also get contracted. This reduces the bleeding. Oxytocin has fewer side effects than ergot derivatives and is preferred to them for prevention of treatment of postpartum hemorrhage. Then oxytocin is also used to increase intensity, frequency of uterine contraction. The more oxytocin given, the more uterine contraction. Intranasal oxytocin may be useful for breast enlargement because oxytocin myoepithelial cells resulting in milk production. So for the milk production purpose, this oxytocin can be given intranasally. This is to be noted. Then let's talk about the adverse effect. Yeah, we know it causes stimulation of uterus. When there is excess stimulation of the uterus, it causes uterine hyperstimulation. This uterine hyperstimulation is due to the overdoses of oxytocin, result in the higher contraction may result to the uterine rupture, fetal asphyxia, or even fetal death, because there will be imbalance of the blood flow from the mother to fetus through placenta. High dose of oxytocin may cause hypotension and reflex tachycardia. This is how the oxytocin works. We will meet in the next video. Thank you.